Hello and welcome to another episode of Ultrasound Tips and Tricks. This week we are going to be talking about ultrasound guided trigger point injections, which I'm not sure actually even exist, but I've found that they're incredibly useful for managing patients with back pain, and so I'm going to break it down for you. So who do we do this on? Well, I would suggest doing this on patients with musculoskeletal back spasms or muscle spasms, not anybody with undefined or undifferentiated back pain or anybody who's got central back pain from like a radiculopathy. All right, so just a little background on these blocks. This is a type of regional anesthesia, which is how I would bill it. And essentially what it's doing is trying to anesthetize a local muscle group. The issue here is that using a blind approach to a trigger point is very hit or miss in whether it's successful or not. And in general, when we have patients with bad muscle spasms, we really don't have a good way of treating them with analgesics. We want to avoid opiates, benzos, muscle relaxers as much as possible, and giving somebody an NSAID prescription really doesn't leave them feeling well taken care of. So this is an alternative. I would not do this injection on anybody who's obese or anybody on really anticoagulants. Obesity will significantly decrease your likelihood of being able to get a needle well visualized into the muscle, as ultrasound just doesn't track well through fatty tissue. And then anticoagulant use, anytime you're injecting into a muscle region, this is something that you want to be cautious with. I wouldn't say it's a hard contraindication, but maybe a relative contraindication, and discuss it with options with the patient before doing so. So what are we actually going to do? Well, we're essentially going to find the area of most pain, which will typically be in the trap area, maybe in the thoracic area, or on the shoulder, in the rhomboid muscle group, or even sometimes in the lumbar region, in the quadratus lumborum muscle groups, or any of the paraspinal muscles. What we're going to do is we're going to find the area that's very tender just by palpating, and then take the ultrasound machine and visualize an area between the muscle layers, and then inject anesthetic into that muscle layer. You're going to be using a long-acting anesthetic. I usually use 10 milliliters of a 0.5% bupivacaine without epinephrine, or a larger volume, like 20 milliliters of a 0.25% concentration bupivacaine without epinephrine. You don't want to use epinephrine. You want the medication to spread along the fascial planes as much as possible, and epinephrine will obviously vasoconstrict and reduce movement of anesthetic. You can also use lidocaine or ropivacaine. I just find that at these volumes, bupivacaine is easy to come by, it's accessible, and we're comfortable using it. So this is an ultrasound image of my lumbar area, the paraspinal. This is my lumbar paraspinal muscle. This is actually my lumbar spinal or transverse process, and you can see the difference between the muscular layer here with the striations, and then with the fascia down here, there's no striations. So the target area in somebody with like a quadratus lumborum strain would be essentially needle entry into the skin at the top of the screen, and then down about 2 centimeters to this area down next to the vertebral body here to the white line. This is an example of doing an injection over the rhomboid muscle group, which is in the mid-thoracics. The same technique can be used in the lumbar region over the paravertebral muscles in any area in the spine. This is one area in which when I do a block, I usually will numb up the skin before I do the block. So I'll take a small needle with some bupivacaine, and I'll draw on the skin a little circle with my pen or a skin marker to the area that actually I'm going to inject through. So this is an ultrasound image of my left trapezius, my shoulder area. This would be trap, and then under here would likely be like rhomboid. And so you've got this area that's just a centimeter or two down, that you've got a difference between the muscular layer, a fascial layer, and then more muscle. And so injection down into this area here will actually serve to get the anesthetic to kind of diffuse in between the entire muscle layers. Whereas if you do a blind trigger point injection and you just bring a needle straight down and blindly inject it into a muscle, you're really only going to affect a very small portion of the muscle. Whereas if you come down beneath the muscle and inject into the whole layer, you'll get a much broader anesthetic application. So this is about the same picture I was showing earlier with the trapezius muscles. What I want to show you also is that other structures in the screen come up. So beneath this is actually two of my ribs. And beneath the ribs is the pleura. And so this would be lung. And so, you obviously don't want to inject through here, and you want to identify everything on the screen before you go for an injection. But in this model, where if I was going to be attempting this trigger point injection, I would take my needle through the top of the screen and bring it through here down into this plane between this muscle group and like this lower muscle group, and try to attack about right here. So this is an example of the ultrasound positioning and the needle positioning over a trapezius, although you can move this around to get this specific area of tenderness isolated. So this is an ultrasound essentially at the base of my neck at about C7. This is kind of known blindly as a paravertebral block, and at C7, an inch lateral of C7 can be done bilaterally for the treatment of migraines, neck pain, cervical strain, that kind of thing. If done blindly, again, you're just taking a needle kind of coming down like into this area blindly, and just beneath here is like rib cage and lungs. So you can actually cause pneumothorax in somebody who's thinner, like myself, without a lot of muscle. So the nice way of doing it with ultrasound is actually find these different muscle layers, and you can see the muscle layers are a lot different with the bright white, just like a fascial block. You're seeing these different layers, and just coming in on the side of the screen, you get the depth. We're only a centimeter down to this fascial layer, and you can inject straight down into here and get that anesthetic to kind of plane out over the whole area and have a really effective block. So to recap, using this type of ultrasound-guided trigger point injection can really reduce the amount of pain your patients have instantaneously and leave them feeling a whole lot better than just giving a pack of Valium and out the door. So to review the steps, first you want to find the area of most tenderness, just with direct palpation. You want to use the ultrasound probe to scan over that area, looking for vasculature or anything else that would be something you wouldn't want to stick a needle into. After you've found the area that looks like you've got two muscle planes that are obviously separated by the different muscle striations, you want to go ahead and put the sterile probe cover onto the ultrasound probe. And you want to clean off the skin with chlorhexidine, and then inject a small amount of local anesthetic into the skin where your needle entry point will be. After that's taken effect, you want to get your larger needle out, go back to the skin in the in-plane technique, inject the anesthetic in between the two fascial planes or into the two muscle layers, and you'll see the anesthetic spread between the two muscle layers. Typically, you'll deposit anywhere between 10 and 20 milliliters into this area very slowly. And then afterwards, so when you take the needle out, kind of rub the area and have the patient kind of lay down, as their respiratory motion will tend to move the anesthetic between the muscle layers. Come back in 10 or 15 minutes, and they'll usually be smiling, happy, and hugging you, and you can send them out the door with whatever medications you want and a smile on their face.